Welcome to Harley Street Beauty, the show that gives you top tips to looking and feeling great. Here's what's coming up on today's show. We go behind the scenes of a tummy tuck surgery.
You don't go into this type of surgery in any way without a lot of careful thought.
We meet Dr. Dan Dunar, the Michelangelo of Botox, as he takes on a complex case.
Oh, this is so good.
I head back to Aviva Cosmetic Dentistry for my ongoing Invisalign treatment.
But that's where you wear.
Oh my goodness.
And that's where you're going to be.
For many people, the state of their stomach is a constant source of worry. I know for me, it's a nightmare. I get stressed out leading up to the holiday season. A flat stomach doesn't seem like it should be that tough to get, but for some reason the fat there is really stubborn. The problem can be compounded by childbirth, which can result in stretch marks and extra folds of skin, neither of which can be solved with exercise, unfortunately. The tummy tuck, or abdominoplasty, is an operation which removes all loose excess skin and fatty tissue. The result? Well, tighter abdominal muscles and a flatter tummy.
I need it, but I wouldn't consider having it.
A lot of people do have glandular problems and other bits of life, but 9 times out of 10 it's just laziness and comfort.
If you want to then go to drastic surgery to try and change that or go back to the way you feel you were, I don't think that's the place to start. You should start with diet first.
It's lazy. It's a waste of money. Yeah, waste of money. There's a natural way of combating that, so you don't need to. It is lazy.
Carol Howard has been through all manner of strife over the last 10 years. She wants to get a fresh new start with a tummy tuck operation. We head over to the operating theatre as Dr. Frame prepares for this in-depth operation.
Went along and saw Professor Frame, and he said, you know, would you like me to do a tummy tuck? So I was absolutely delighted, because over the 10 years I wasn't really looking after myself properly.
This is not a simple operation, and somebody like Carol hasn't gone into this lightly. She's aware of the risk. She's overweight, she's ex-smoker, her problems there are sweat rash, not able to get around, and worsening arthritis, knee pain, hip pain. So it's a vicious circle for her. So this is what I would call aesthetic surgery with functional reasons, functional overlay. There are people that die after a massive weight loss program of surgery. So you don't go into this type of surgery in any way without a lot of careful thought.
I've had 10 years of really bad luck. Lost my father with Alzheimer's, I lost my mother, I lost my sister. They all had to be nursed and looked after. My husband got cancer. So that was a traumatic 18 months, and then he got ill again and had to have a serious operation done. Then things began to pick up for us, and I thought, well, hey, maybe it's about time I started looking at me.
So we start off with a Brazilian. Instead of the traditional one, which is we make a big long cut underneath and reflect the whole tummy wall, what we do is we tend to start centrally and take out everything down to the tummy wall in that small little mono block, and then see what happens to the muscle layer, because the muscles tend to separate on women after they've had children. And Carol's no exception. Her muscles are separated probably about 5 to 7 centimetres or so. So just by pulling that muscle together, we immediately get a better result. So what we're doing is taking a little corner. We want it to be slightly dimpled. We don't want it totally dimpled, because otherwise it looks bad, but a little bit of a dimple. It's just a vacuum. So like it's air, but it's less air, but it's vacuumed into a space. Sucking through a vacuum. Yeah, really it's a big operation. It's going to 4 to 6 weeks before she's back to normal, probably even slightly longer. It will look good. The other things that we're doing now, they're going to bruise her a bit, so we're just going to make sure she stays in good health. So post-operative, I would expect her to be a bit puffy, and that will go down probably some months later.
I was apprehensive, but I felt safe because Professor Frame was doing the operation. He is a genius as far as I'm concerned, so I felt I was in safe hands at that time.
We find out how surgery went a bit later in the show. Most of us have heard of Botox, but not everyone knows the versatility of this treatment. If you're thinking of getting it in time for your wedding, we've got some essential advice for you from Botox guru, Dr. Dan Duna, the Michelangelo of Botox. We headed to Dr. Dan's Harley Street clinic to find out more.
Hi, my name is Dr. Dan Duna. I'm actually a GP by trade, but for the last 10 years I've been involved in medical aesthetics. I'm an advanced cosmetic doctor, having trained many people all around the country, and I'm also country ambassador for Allergan, the manufacturers of the Botox brand, Juvederm and Voluma. Botox is a very powerful drug, and when injected appropriately, it relaxes facial muscles to give a very pleasant, relaxed, confident look. I'm about to treat Polly, who contacted me. She's a working mum with a very young baby, and she's come all the way from Glasgow today.
The older that I'm getting, I feel as if I'm starting to look drawn and tired, and just my face seems to be falling, so I'm wanting to give it a lift to make me feel better. My self-esteem's right down low.
Polly has a lot of acne scarring, and she's been troubled by acne as a young lady, and it really has affected her confidence significantly. She told me that there's days when she gets up in the morning and she can't bear to even look at her own reflection. She can't even bear to go to work, and it's very important for her to keep up her daily lifestyle, and it's actually brought her to tears on many occasions. I'm going to be using Juvederm Voluma, which is a volumizing filler from the makers Allergan. It's a very soft, gentle filler, but it has huge lift potential.
I want to be fresh looking, and I don't want to be torn down so much. So excited.
We're going to do some Juvederm Voluma and pick those cheeks up. It can restore some of the contour of your face and make you look less tired. And then what I think I'm going to do is I'm going to finish off with a little bit of Botox just to freshen up the upper part of your face and just hopefully lift the eyes a little bit. We won't see that straight away. That'll take a little while to develop, but it might also be an idea to just put a little bit of advanced Botox around the jawline. That'll just help tighten things a little bit and work really nicely with those new cheeks that you've got, okay?
That sounds fantastic.
We're going to restore the proportions in Polly's face and give her back that youthful look. This up again, so I'm just going to drop a little bit of anaesthetic just here, okay?
Thank you.
Alright, just relax with me, so it's a little tiny sting. What we're trying to fill is actually this sort of section here. And if we actually fill that section, this will actually lift. And if that is actually lifted, you can actually see how that pulls that up. Alright?
Sounds great.
Okay, fantastic. Alright?
Yep.
We're going to be using a micro cannula, okay? And it's actually a blunt needle. Okay, sounds terrible, but it's not at all. Okay, so we've put a little bit of dental anaesthetic in. That's just near the surface of the skin, but I do need to make a little pilot hole, a little entry point. Okay, now I'm going to do that now. You really shouldn't feel that at all. I'm going to take that little needle out, and it'll just make a little entry point, and I'll be able to feed my cannula very gently into that, and that will be able to sort of cover quite a large area. You feel that?
No.
Okay, brilliant. And what I'm going to gently do now is I'm just going to very gently inject some product, and as I'm injecting, the product Juvederm Voluma has actually got some built-in anaesthetic. So it's going to start numbing the area out.
I can't feel anything, there's no discomfort, there's no twinges, nothing. I found that when I got Botox the last time, it was quite painful. I was flinching a bit. This I cannot feel one bit.
Wow.
It's absolutely brilliant.
And then what I'm also going to do is put a little bit just around the eye and just give me a strong smile. There we go. So you can see that contraction all the way across there. So I'm just going to soften that out. And again, that's going to open up the eyebrow a little bit from the outer portion. So I'm just going to deposit some Botox just here.
I had some Botox before on my frown lines, and I had some fillers there. I didn't find it worked that great for me. It didn't give me the result that I was looking for.
I'm just going to inject a little bit of Botox along this jawline. And we're done. I'm going to put a lovely cooling, vitamin-enriched ice mask which has come all the way from Switzerland.
So cool.
Here we go.
Oh wow. Oh, that looks so much better. Yeah, it's really plumped out. Yeah. Fabulous. This is so good.
Happy with that? Mm-hmm. Always put more.
We'll find out how Polly's checkup appointment went a bit later in the show. We're going to go for a short break right now, but join us in a few moments. Welcome back to Harley Street Beauty, the show that helps you look and feel amazing. Coming up on Harley Street Beauty, I head back to Aviva Cosmetic Dentistry for my ongoing Invisalign treatment.
It's not far to go.
No, it's not.
Very, very quick.
We join Professor James Frame as he performs a tricky tummy tuck operation.
It did get complicated when I was in theatre.
Earlier in the show, we followed Carol Howard into the operating room as she was about to undergo a tummy tuck surgery.
The 10 years I wasn't really looking after myself properly, and I thought, well, hey, maybe it's about time I started looking at me.
We go back to Dr. James Frame now to see how the operation went.
We've just operated on Carol, and we've just done her abdominoplasty, which we call the Brazilian abdominoplasty. It's quite traumatic. I mean, for those that understand what I just did, it's not traumatic, but for those that really haven't seen very much of this, it looks actually pretty nasty stuff. Yeah. So we had two things. One was a thing called power-assisted liposucker, which is a machine that agitates very quickly and allows the fat to come out with less trauma, if you like, through this traditional vacuum. But more importantly for us, since I started doing this Brazilian, I've been using a thing called the harmonic scalpel, which is an ultrasonic thing. It makes this very, very rapid movement that liquefies the fat as it's contacting onto this blade. And I just perforated the fat, if you like, with many, many round holes. And then I know that when those round holes are pulled downwards, they become slits. So the slits then close up. The way we've done it today is less discomfort, easier to get over than conventional abdominoplasty. Somewhere between 20 and 25% of abdominoplasties have some sort of problem, ranging from fairly minor to really quite major. And the major complications, when you have one, are really quite catastrophic.
I felt absolutely fine, but the hours went on. It did get complicated when I was in theatre. They found out that I was having breathing problems, and they detected that I'd got fluid on the lungs. My heart started playing up. Apparently only one side of my heart was functioning, and I'd lost quite a bit of blood as I became terribly anemic. For the first 3 or 4 days I was very, very unwell. Then I had to go back on a weekly date basis for about 7 weeks so that they could keep an eye on the wounds, because I bruised extremely badly and my stomach had swollen enormously. The pain was excruciating. I felt as though I got 2 leather belts tied around my stomach, pulling on raw flesh. I was lying there on several days thinking, God, what the hell have I done? You know, the cosmetic surgery actually threw up that I've got a heart condition, which in a way it's better that I find out now rather than end up one day just having a heart attack. But that, funny enough, now seems such a long time ago, and I was just one of those very odd 1 in a million that reacted to surgery. The results at the end of the day are absolutely amazing. As time now has passed on, I'm feeling on top of the world. I'm not saying I really want to go through that experience again, but I think if I'd been 100% fit, I would have been fine. But yeah, if you want your arms slimmed down and a tummy tuck done, I would say go for it, without a doubt. I'm now considering maybe having a facelift done.
Invisible braces are becoming much more affordable all the time, and their subtlety means that many more people are stepping forward to fix up their smiles. Over the course of the series, I've been undergoing an Invisalign treatment at Aviva Cosmetic Dentistry. My treatment is past the halfway stage now, so let's see how I've been getting along. It's now week 16 of my Invisalign process and treatment. I'm on my 8th set of aligners and I'm about to have my 9th set. So I'm going in to see Julian Kaplan at the Aviva clinic to see how he thinks my progress is going.
Okay, well, how's it gone? What's any issues, any problems?
No problems so far. It's great, and I'm getting used to obviously taking it out when I'm drinking or eating anything with colours.
Stain.
Exactly.
Exactly. So anything which will stain your white shirt,
yep,
you wouldn't want to put in your mouth with your Invisalign
exactly.
in. You'll find that when you put the aligner in,
yeah,
you get that tightness. It means that the teeth are moving maybe about 0.1 of a mil. And then after that, for the rest of the 2 weeks that you've got it in, it's not really doing much.
Right.
So it's like there's a movement time
okay,
and then a settling time. So that's why you get tightness and then it sort of feels a little loose after that.
Okay, great.
Okay. So today we're just going to, I'm just going to have a check, make sure it's fitting correctly still. And then I'll just check it cleaning properly and making sure you're looking after it properly.
Okay.
Being a good girl.
Yes.
And then we're going to go downstairs and we're going to have a little look at the Invisalign actually on the screen and just check that you are where we think you should be. So let me just have a little look with this in place. There we go. So I'm just hanging onto that and move that around. So I'm just checking that the little bumps that we've put on your teeth are nicely aligned with the actual aligners, actually sort of sitting in there correctly. And that'll look great. So I'm going to get you to take it out. You're an expert at doing that now, of course. There we go.
Yeah.
You are. When we first start that, you go, oh, it's a bit tight, how am I going to do it? That's a tissue for you.
Thank you. I brush the aligners when I brush my teeth.
That's great, yeah.
Twice a day.
Absolutely, yeah. And really, every time you eat, you should then brush your teeth and clean it if you can.
Yeah.
And they really are now far better line. You'll be amazed, actually, at where we are now with that. That is a lot better. So we've widened your arch. So most people we find have a V-shaped arch, and we want to give you a nice U-shaped arch. It gives you that nicer, wider smile. So just pop those back in, if you will.
Thank you.
So that's where you wear.
Oh my goodness.
And that's where you're going to be. So it's a lot wider, nicer, more even smile.
Wow.
The lower ones look even better.
My front 4 teeth were quite uneven, weren't they? And
exactly.
The short side ones quite a lot higher up.
Absolutely. And we go from that to the end result, which is this.
So each set of braces lasts for 2 weeks.
Exactly.
So
this is 16 weeks in.
Yeah.
Exactly right.
Okay.
16 weeks in. We put in 8 aligners now.
8 aligners, and we have in total for the bottom 14 aligners.
Correct.
28 weeks.
Correct.
Okay. I'm really noticing a big difference on the bottom.
Yes, you can feel
I'm
that with
noticing
your
it
tongue.
on the top, but I really feel it on the bottom.
Yeah.
Might sound bizarre, but
no, your tongue feels that smoothness on the inside, and as well as things looking nicer at the end, it's also going to be great for your health because you've got to clean teeth more easily because they're not so crowded. Much more easy to clean.
So less complications with potential infections and
gum
stuff.
diseases and all that sort of stuff.
Even when you're flossing,
Easier
if you've
to floss.
got crowded teeth, it's really hard.
Absolutely. So we're going to see you really probably towards the end of the treatment now. We're going to see you at the end and just check we're happy with everything. 3 aligners, 6 weeks left.
Gosh,
so
that's exciting.
Not far to go.
No, it's not.
Very, very quick.
Earlier in the show, Polly went to see Dr. Dan Duna for her acne scarring, which had always made her very self-conscious.
I feel as if I'm starting to look drawn and tired.
A couple of weeks later, Polly was back at Dr. Dan's clinic for a checkup. Let's see how she got on.
I had some fillers, some cheek fillers. I had some fillers on my laughter lines. I also had some Botox here, the side and up at the top, and some fillers under there.
Botox as a brand has been around for about 10 years or so, but the actual protein has been around really since the 1950s. It was originally used to relax excessive facial muscles involved in eye squints and blepharospasm, flutters of the eye muscle. Treatment in Canada in the late 80s, in the 90s, actually led to its use in relaxing over-expressive facial muscles, which can lead to such lines as crow's feet and frown lines.
I feel great, I feel a lot more confidence. A lot of people have noticed that I look young, but healthier and not so tired and drawn out. So no, I feel really good now. I would just get dressed to go out, and as I went down the stairs I'd catch myself in the mirror and I wouldn't go. I would just go, right, that's it, I'm not going out, because I felt I looked quite bad in myself, so I would just take my jacket off and just stay at home. So hopefully now, nope, no more.
Over time, we have actually developed the Botox brand further. Allergan, international manufacturers of Botox, have spent a lot of time and research in developing the brand. What we now realise is the versatility of the Botox protein. Some treatments, such as Botox injections, have got a bad rap in the UK because unlicensed, untrained, unexperienced practitioners, both medical and non-medical, are unfortunately treating patients. A lot of practitioners in the industry don't seem to understand the artistic nature of medical aesthetics and of treatments such as Botox injections. The result is that they end up with patients that look very, very stark. You end up with a sort of Stepford wife look. Everybody looks like they've come off a conveyor belt. I truly believe that treatments such as Botox and filler injections are very much 80% art and 20% science.
Last time I had it done, I actually had my thumb to squeeze when it was sore. No, I took my hands away because I don't need to. There was no pain. It's amazing. It's so good.
Juvederm Voluma does have longevity for up to 18 months. Obviously, some people will naturally break down that product a little bit earlier and some people will break that product a little bit later. But certainly one would hope you get a good 12 months longevity out of this, if not more.
I'm really glad I got it done. I know for a fact I won't be worrying about what people think of me or, you know, what I feel myself. I feel confident.
The benefit of it is marked by, you know, patient satisfaction globally, worldwide. You know, these products are licensed all over the world with huge satisfaction rates.
That's all we've got time for today, but join us again next time when we'll give you more top tips to looking and feeling fab.